At the World Health Organization, we believe that people and communities must be at the heart of our efforts to prevent and respond to sexual exploitation and abuse. But we also know that this is easier said than done, that we must go beyond policies and beyond lip service. Any form of sexual misconduct by our personnel and our partners is prohibited and will have serious consequences. WHO started our work in this area later than many agencies, but now we are on the long road to operationalize our commitment to zero tolerance for SEA, as well as sexual harassment of our own workforce. Sexual exploitation and abuse casts a dark and shameful shadow on our development programs and our humanitarian action. It is a violation of human rights, and it impacts not only victims and survivors, but also their families and communities. It is a violation of the trust placed in us, and we need to seriously examine how we work at community level. Communication and community engagement provide a set of approaches, tools, capacities to mobilize the wishes, needs, wants, and the insights of the communities that we serve so that we can better shape prevention of sexual exploitation and abuse work throughout the safeguarding cycle. Communities should be involved in identifying SEA risks. They are best placed to propose preventive actions and contribute to our own preventive measures. Only they can provide insight into setting up safe and accessible community-based complaint mechanisms that suit them. They can tell us what services exist in the community and what they expect from us as services, and to ensure that perpetrators are punished. Remember, they are always the first respondents in cases of SEA. We, in turn, need to solicit their feedback and provide timely feedback to them on the actions that we have taken. Their insights, feedback, and ideas are essential for us to provide and collectively learn to improve and strengthen safeguarding work. While awareness and attention of SEA may be more recent, communication and engagement of community history, the right to participation, the use of participatory approaches has been around for a long, long time. So the question is, how can we strengthen CCE work and bring it to bear on the urgent, important imperative to address sexual misconduct head on? First, I think we should be intentional about communication and community engagement, especially because this is a topic that is very difficult to tackle, and it's difficult to find the correct language and approaches even to start the conversation. We need to bring in the right expertise, use participatory tools, find out the concerns of community and their existing culture, their context, the barriers, their trusted networks, and involve the communities in the awareness raising and planning from the beginning of an operation. It should be a pillar of our response, reporting to the leadership for all aspects of an operation, including for SEA, from the outset. And as such, it must be resourced adequately with people and activity funds. We really have to address the barriers to participation. We need to listen first. Choose trusted interlocutors, but remember, those most at risk of SEA may be the most vulnerable, the least represented, and often hidden and silent. Language. Local language is everything. We need to create safe spaces and approach or at risk of stigmatization. We need to consider literacy levels and community preferences and use context-appropriate technology. We have to take preventive measures to ensure all community volunteers who are part of our operations know and understand our zero tolerance commitment, and they stick to the standards that we have for PSEA. We need to train and brief them regularly. We need to commit to continuous dialogue, not one-off and not one-way communication. Posters are not CCE. No agency can do this alone. This is essentially teamwork in the broadest sense. Teams that reach across silos, sectors, clusters, agencies. Teams that are focused on our common objective to do everything in our power to prevent SEA and to respond effectively and swiftly when transgressions do occur. WHO values highly our membership in the CDAC network. We believe that collective action through CDAC can better embed CCA in all our work and draw on our collective expertise and experience to generate the data we need for evidence-informed action towards meaningful communication and community engagement to address sexual exploitation and abuse.